In the following presentation, we'll talk about the importance of attendance, time, and leave management in residency programs. We'll first review a PowerPoint presentation, and then we'll take a brief look at Interact's residency program management application. First of all, if you look at what the ACGME says on duty hours, it says very clearly that residency programs must be committed to and be responsible for promoting patient safety and resident well-being and to providing a supportive educational environment. It also says that learning objectives of the program must not be compromised by excessive reliance on residents to fulfill service obligations. And then it states that didactic and clinical education must have priority in the allotment of residents' time and energy, and duty hour assignments must recognize that faculty and residents collectively have responsibility for the safety and welfare of patients. So it's very clear that time is an important matter to track, to be aware of, to understand how much the workload is on particular residents, to make sure that the ultimate objective is achieved, which is the safety and welfare of the patient. So tracking time has many different components. Tracking information within a CME program is knowledge, information, and data intensive. Now, just a few elements to look at is rotations, where you need to be able to plan the rotation in the future, assign residents, assign cases, and do performance reviews. So planning is critical there. In terms of actual time tracking, you have to worry about daily attendance, punctuality, overtime, and on-call hours. In terms of tracking leave, you need to know leave balances for every type of leave, and you need to know the overall leave plan for the department. And finally, you need to define schedules for rounds, shifts, procedures, training, courses, and academic activities. All of that has to be viewed all of this information needs to be in one place and needs to be viewed as a whole so that you do not miss important information when it comes to somebody's leave intentions versus assigning tasks to that person and so on. For example, it's very important to know for a consultant if a resident is going to be on leave the next day, because an urgent case cannot be assigned to the resident in that case. So all of these things are connected, and it's critical that you have a system in place that helps you manage that more effectively. Because if it's done in a manual manner, it's time consuming, it's error prone, it's not scalable, and most of all, it's inefficient and costly to track that kind of information in a manual process. Typically, residency programs are part of a wider and larger organization, and in many cases, the residency program does not have the tools available to it to manage that kind of data, because it may be tracked at the higher level within the organization, but not at the level that is required within the residency program. Physicians' work today requires mobility. You need mobile technology for mobile work, and therefore you need to be able to track your time using different tools. That can be an iPad or an iPhone or other similar tools. And you need to be able to use time and attendance terminals to track people's punctuality, attendance, and that can be done with fixed terminals or mobile terminals. So this presentation really focuses on the fact that scheduling and time management is a critical component in that bigger picture. The bigger picture meaning all the different modules which are covered by Interact when managing residency programs. One of the other elements in the residency program and the final outcome of managing that within an application like Interact is that you will get an integrated resident electronic record. Having everything online means you will save time, because that electronic record will include information about demographics, education, references, admission information, competencies, rotation plan, schedule, and so on, all of it in one place, including quizzes, patient assignments, and more. Now, with this being accessible from the internet, that information is all in one place. You will access it from anywhere as long as you're authorized to do so. You don't need to install anything on your PC. So it becomes a lot more user-friendly, a lot more efficient to work that way. One of the key advantages of Interact's iResidency module is how it connects everybody in the organization within the residency program, starting with the program directors and the consultants, And obviously, the residents, any external rotators, fellows, scholars, interns, students, alumni, anybody, including the program coordinator, obviously, anybody can be given access to a portion of the system so that they can manage the data that is relevant for them. Interact's iResidency also supports multi-locations, meaning that your residents can go for rotations in other locations. They can send their timesheets back, or consultants can log in and provide you performance evaluations and send them back to you. All of that being done electronically without any actual manual intervention to make sure things are happening. Obviously, the consultant will have to log in and put in the information, but that again can be done on a mobile device. The whole idea is that with that technology, you can plan better, learn more, work more efficiently, and have the system monitor and inform you if for any irregularities. You define the benchmarks, and if anything goes outside of those benchmarks, the system will let you know. So approvals can be done through workflow, and the system will inform you and monitor anything that is out of the ordinary. So information can flow from any hospital into the main hospital where the residency program is based, or in the opposite direction where you're sending information to other hospitals for people, for residents that are coming from those hospitals working in your institution. As mentioned before, you get a unified electronic resident that will contain all the information, including occupational information, which would include certifications, publications, speaking events, associations, and any other information that you need to track on your residents. This gives you a bigger picture of the entire framework. You define as many residency programs as you need to. They will have specialties and subspecialties. And for those residency programs, you'll define training periods for each rotation, which will consist of multiple training courses, may be taking place in different locations. This particular presentation today is about the scheduling and the time and attendance information that you will be tracking. Obviously, the whole objective is to help you develop more competencies for the residents so they can provide better service to the patients. And in order to evaluate that, you'll do performance plans, you give specific goals, and then you have specific competencies that will be evaluated. Beyond that, there will be exams and quizzes that can be defined for each modality, and all of that will be managed through one single system. Here are some examples of screenshots which show you the definition of a standard residency program with all the information that we need to track, including the program director, obviously, the number of residents allowed, and much more information. We can integrate to other systems, let's say a PACS or a RIS system, that will require you to pull images, for example, in radiology, where you may want to include quizzes for those specific images. Now, that will require an HL7 interface. Here's the definition of a rotation, where I can define all the training courses and define all the detail that I need to know for a particular rotation. Here I have a residency application because we also track the actual recruitment prior to the residents joining the program. Quiz questions will be linked to a specific case image, as mentioned before. That will be attached here, and those questions can then be created by the consultant and can be scheduled based on specific criteria. All the information will be collected here and then will be presented to the residents to complete through self-service. You can define radiology exam orders and assign them to a specific resident, and that will include information that needs to be obtained from the patient prior to the exam order. Then the resident can fill in a quiz on a particular item based on a specific image that has been reviewed, and you see that the resident can include all comments in terms of interpretation about that particular case. Patient information will be collected, obviously, because that will be linked to the cases that are being evaluated and tested. So, in essence, everything that is required will be in one single system. And that system can then integrate to other external applications, whether it's a hospital information system or a PACS or RIS system in radiology. there's really no limit to what kind of integration can be provided as long as everything has been put in place correctly. Interact is a global company. We're based in Washington, D.C., but we operate around the world. We're focused on providing solutions related to human resources and specifically in healthcare, government, and higher education. You can reach us on healthcare at 2interact.us on these particular programs. Now let's take a real quick look at the product itself one more time. Here you'll notice that every person who logs in, whether it's a program director or a consultant or a resident, will be provided with those KPIs that are relevant for that particular person. So any type of quality indicators that you need to be tracking, any key performance indicators will be provided to you to understand the information that's relevant to your program. This could be, for example, performance statistics in terms of number of cases handled by a resident, or it could be attendance information, could be leave records, it could be anything that we need to track, that we need to be aware of to make sure the program is being managed correctly. Now we can go and look at the resident electronic record, and here you'll see the resident electronic record for Barbara Anderson, which will include competency evaluations, it will include performance reviews, it will include her leave records, her job details, her experience, but also a lot more, including certifications, publications, speaking events that she's attended, and so on. And obviously the timesheet, because this presentation is really focused on how time will be tracked. So the leave information is coming from leave requests which have been entered by the resident. If we go and look at Barbara's self-service, because every single member of the residency program will have their own self-service screens, and there they will be able to put in leave requests, for example. And these leave requests will be sent through workflow to the right people that need to authorize the leave. That way, you don't need to manually track that kind of information anymore. It will be automatically maintained. The resident will put in the start date of the leave, the reason for leave, can attach a specific document if required, and put in the number of days requested. That will then be sent for approval, and once that's done, automatically the records will be updated and the program director will have a clear picture about how much leave is still available for this resident and whether or not there's any overlap within the department in terms of leave. Residents will be able to track their attendance, and they can edit their own attendance if required. And the same thing can happen in terms of timesheets, where specific time will be allocated to specific cases or specific rotations or any other information or rounds that need to be tracked. This can be done at the activity level. There are a lot of ways that information can be tracked and entered by residents. For example, this would also include procedure logs where we can keep specific information online, and the program directors or consultants can be asked to review and approve specific timesheets. So the whole purpose of Interact is to let people log in and manage their data as much as possible themselves so that less time is spent looking for information or trying to provide information to other people. All of that will be done online, and the system will send alerts to the right people through email, SMS, and on the personal page so that that can be maintained. And also, you will be able to interface to attendance terminals, which we indicated earlier, either a fixed or a mobile terminal with the fingerprints, so that whenever the residents are on the job, the system will know that they have turned up on time, and during the period when they are expected to be away on lectures or away on leave, the system will not alert you because it will be aware that this particular person is now on leave. This gives you a quick overview of what Interact can do in terms of residency program management, and specifically how it would handle time sheets, because many different time sheets will be used. Different work schedules can be assigned. People can use shift planners in order to make sure that the right people are on the job at the right time. And timesheets will include as much detail as you want based on the requirement of the specific program.